Yeah, Carol wanted everybody to know the word from the horse's mouth.
You look gorgeous. You have your necklace on. Do you mind? Is it okay? Because we have a whole board of directors.
Oh my God, it's so embarrassing.
Yeah.
So his anal sphincter is working fine. So what he has is what are called perineal hernias, okay? What's really unusual about this is that he's a kitten, he's a young cat. I've never seen it in such a young cat. Normally what it is a result of chronic straining to either pee or defecate. So we usually see in older cats that have chronic lower urinary tract disease or chronic constipation, like megacolon, where their colon is not working. And so that's why it's so important for me to see those x-rays, because I don't know if his colon is working. And I don't know if his urinary tract is healthy either.
Well, he pees very normally. I mean, obviously, I was just saying to Peggy, should we put him in a newspaper article to try to get history, but you know, my guess is it was a chronic problem and he got kicked out of the house.
Well, that's probably why he was given up.
He was thrown out. He was found outside.
That's what I mean.
Yeah,
probably why.
Given up the easy way.
Right, that's probably why they got rid of him.
Yes.
So let me show you what a perineal hernia is. So I'm going to get a little sort of, I mean, if you're uncomfortable with defecation issues, I'm going to get a little, all right, I'm going to get a little detailed. So here's the rectum. So we're looking down on top of the cat. Here's the rectum, and then here's the anus with the anal sphincter muscle in it, okay? So, and then there are these muscles on either side of the rectum, okay, like that. So we're looking down on the top of the cat.
Okay.
So when poop comes in, okay, and it stretches the rectum, it tells your body poop's coming down, and you squeeze your anal sphincter to hold it in. And then when you're ready to go to the litter box or you're ready to go to the toilet, you relax your sphincter, squeeze your abdominal muscles, and the poop comes out, okay? There are these muscles on either side of the rectum that keep the rectum straight and that keep the poop going straight out the body. What a perineal hernia is this. So there are either weak muscles or no muscles over here, and so what happens is that the rectum starts to fill with poop on either side. Okay, so when the poop comes down, it starts to fill these pouches on either side and poof out, and that's why he's painful, because he's got poop. The poop goes this way and expands and stretches, and he strains and strains and strains, and he can't poop because the more he strains, the more poop goes that way. The more poop goes sideways and not come out that way.
Now, this is making these really dramatically big, gigantic logs.
What worries me about that is I'm concerned about the function of his colon, his large intestine, because that's not normal for a cat.
Right.
I mean, that's a dog poop.
Yeah.
But you've not seen a cat on this food before? This fiber? You have?
Yeah,
and it doesn't do anything?
Yeah.
No, okay, that's what we didn't know.
What it does, so what fiber creates bulk.
Yeah.
It creates bigger, softer stool. But for his stool to be that, it should be in smaller pieces.
Yeah.
So I'm not sure what his large intestine is doing.
They told us that it wasn't megacolon from the look of that X-ray.
I know, that's what I just checked my email again, and it's not there. So I mean, we can repeat X-rays. The one thing we need to do is we definitely need to check his urine. I know you say he's urinating normally, but we need to be sure that his urine is normal, that he doesn't have any urinary issues. I am concerned, so the question is, why is he, is this a congenital defect? So the muscles that are missing over here, is that a congenital defect? Was he born without these, what we call the perineal wall muscles? So was he born without those muscles, or was he born with intestinal problem like megacolon, and he's had such chronic straining that now he has these hernias? Okay. So those are the two things that I'm thinking about. Okay.
Yeah, great.
Either way, we do surgery for perineal hernias every day. It's a pretty straightforward surgery. What we do is, so here's his I'm kind of looking down on things. Here's his pelvis, okay? And then there are these muscles inside the pelvis that what we do when we go in there is we scrape them off the bone and flip them up and move them over here.
Create some muscle.
So create a wall. We create a muscular wall in that area, okay? Again, he's really young. I don't know what I will find surgically when I get in there. I mean, if these muscles weren't even developed, the surgery is going to be much more complicated and much more difficult. But if he's the typical perineal hernia that we see in dogs or in older cats, then it is a fairly straightforward surgery. And I usually tell people about 85% chance that we're going to help him and he's going to be better.
And Peggy and I were saying, like in humans, you hear hernias are incredibly painful in and of themselves.
This type of hernia is painful, can be painful, yes.
Even without the stool out here, because it doesn't. This seems to be keeping the stool in a line.
Yep.
But like, is there like that you'll hear hernia strangulation?
No,
no,
not in this type. Right, not in this type of hernia. That's
Why
correct.
is it partly as a layperson? Like I say this 100 times a week to myself. It's like, why is it painful?
Yeah. Well, when you stretch the rectum, that causes stretch receptors to be fired, and that causes pain.
Okay.
Stretching of the rectum is painful.
So it's partly just that it's
It
so
could be.
big. It's,
Yeah.
Will the surgery help with the pain?
Well, that's the thing. I don't know because
what's wrong?
Well, if this is a congenital defect, then the answer is yes. The answer is that should go away after surgery. But if he has some issues with his colon, they might not go away.
Right.
The answer is I don't know.
Colon treatment.
Right,
So
and
the
that's
X-rays are really
important.
Yeah.
So, and I also want to show that to internal medicine. I'll show that to one of the internists. Yeah.
no charge.
Lots more. He makes it for me very regularly. I just have to make sure I don't step on it when I go in the room.
Oh my God, the poor guy.
Oh, the poor guy.
Yeah.
That's right.
Carol, before he went on this food, what was his poop looking like? Was it smaller?
Because we had.
Because it was
enemas.
going in here.
It was enemas.
It was going.
So you never saw him take a somewhat normal poop?
He was backing up in the hernias. That's why.
I don't think
it was all
I ever
backing
saw
up.
anything normal. You know, it would be cruel to do, but to take him off it for a few days. But then we just end up with an obstipated cat.
All right. So potential risks of surgery. So obviously potential risks of surgery. Obviously the obvious risk is we don't make him any better. But that's an incredibly low risk. I do feel like I can make him better. The second risk is, once I go in there, if this is a congenital problem, if I don't have enough muscle to close these hernias, what we end up using is what's called mesh. Mesh is a synthetic material. It literally looks like a mesh. It's synthetic material, and so anytime we put synthetic material in the body, we worry about infection. So that would be a concern.
How painful is healing? Like how long? Well, I know working here that you'll give us a treatment plan and
absolutely, pain medication. Yeah, he's going to be uncomfortable, absolutely. Yeah, but he'll go home on pain meds. I'm not too worried about that.
How long does he stay? I mean,
it's an overnight stay.
Oh,
yeah, it's just an overnight stay, and he'll be on pain meds for 2 weeks, and we'll have you continue the fiber diet and all that kind of stuff. And then the other serious complication, which again is incredibly rare, is whenever we do these surgeries. So there's the nerve. There's a very important nerve that comes out right here, and that gives a branch off to the anal sphincter. And if that nerve is damaged, obviously they can become fecally incontinent. Okay. So.
Well, that's why we came to you.
Right, that's exactly you. That's why you come to a boarded surgeon. We know what to look for. We know how to avoid it. Exactly. So
Sam Simonelli said she would never.
You don't want to
consider it.
No, you don't want a GP doing this surgery.
You're doing
exactly.
This. Yeah, she right away supported coming right to you.
Yeah, definitely. So that's the only missing piece of the puzzle is this just a primary problem or is it secondary to something else going on? So I think we need to figure out, is this secondary?
And we don't want to tie you up looking for the x-rays again. If you want radiology to look at them with you anyway, it may be, like, we don't need to know today. He's not in agony all the time.
Yeah, right. This is something that maybe we need, I definitely think we should get some, has he had any general blood work?
No, but if you don't mind, we could get that done at Paws, because they do like an
Okay.
incredible discount rate.
All right, so I'll write down what I would recommend for
Yeah.
you guys
And
to
then
get. That's
I
totally
can
fine.
take him over there.
Yeah,
even
you're gonna
today.
want to do a complete. I'm sure he's been
Yeah.
feline leukemia and FIV.
Yes.
Yeah.
Okay.
Yeah.
Yeah. So you just want to do a complete. I'll write it down. But you'll do
Yeah.
a complete blood count and a chemistry profile and a urinalysis.
Yeah, we'll do
Um,
everything, anything you think they can do
Yeah.
over there.
Yep.
Yeah,
and
you
then,
wanna make sure
we want to
there's-
look at the X-rays. I want to look at his pelvis, his colon, those kind of things.
Yeah.
And then if all that seems pretty normal, then we should schedule the surgery. And then after recovery, you know, like I said, 85–90% chance that he's going to be okay and he would be adoptable.
He wouldn't be in pain anymore, so.
Right, he'd be able to poop normally and away you go.
Like you're restoring the muscle.
The wall, you're restoring
So I
the
must admit,
perineal wall.
Can you write down like what I could, or like how I could research it, or any
Yeah, I'll write down the
articles?
diagnosis for you so you can look it up. I mean, you can go to, I'll recommend some websites, because, you know, if you do some general internet search, you want to make sure you read, you know.
Reputable.
Yeah, something reputable, yeah, you know what I mean, you know, like Joe
And
Schmo
we
down the
will.
street, who's, yeah.
And there are
Yeah.
people on the board who will read.
Yeah, but if you go to,
medical
and I can print some stuff for you too,
Yeah,
so that's not a
that
problem.
would be, and it doesn't have to
Yeah.
be today again.
Yeah, no, I'll do it right now. All right, let me, go ahead.
I don't even know how to, like, so if you have, it's also new to me. So if you have the muscles again in place, it holds everything
Yep, everything stays
properly
straight.
until the rectum can work.
Well, it allows the rectum to keep everything going straight. So I literally, I restore everything back to
Yeah. So he
this.
then
So the poop can't go that way, the poop can
get
only go
the
that way.
signal, and the signal's not so pain.
Well,
not in
he's
so much
getting the
pain.
normal signals. So
Okay.
his signals seem normal. What's
Okay.
happening is the poop is not staying straight, it's going out in this direction. It's going out in here.
Maybe that's why
Okay.
the curly Q thing happened.
Well, it's possible.
No, it's so weird.
Yeah, but he definitely has some
Okay.
hernias.
Okay, yeah, and that's what BCA thought, and
Yep.
You
You know,
know,
she was
so-
right. She was
yeah,
right.
Yeah,
Definitely.
so, and it would be great if he would poop for you, so someone but me could see it.
All right, let me just go
Okay.
talk to IM a little bit.
You want us
about
to,
this.
you okay?
Yeah,
with that?
you guys. Yeah, I'll type up a discharge, and
And he's very happy once you're not messing with his butt.
oh yeah, he's
a
like, you know,
great
you mush his
cat, isn't he?
face, and you know, you squeeze his face. He's really. Oh yeah, he's totally.
And the
into
pain
it.
doesn't, how long, I mean, this is a stupid question, like, he's not in pain anymore
Well-
after you, he came in
All
and
right,
licked himself a
so
little.
I know I do a lot. I'm sort of.
Pain.
I consider myself sort of an expert in pain and stuff like that.
That's
so
what I told
he's been
everybody.
in chronic pain for some time. And so when you're, you know, even as a child, when you're an infant and you're in the NICU, and you know, if you're exposed to painful situations when you're very young, and it's not, and that pain is not treated appropriately, then over time, as you get older, you become hypersensitive to pain. Okay. So if we go ahead with the surgery and if we go ahead with things, I'm gonna probably keep him on some pain medication for a long time, like a few months after surgery, to try to decrease that hypersensitivity that he's feeling in his spinal cord and his brain. Because we don't want him, we want someone, we want him, like if you can see, if you try to pet him back there, he won't have it. And that's because that's called, in human medicine, that's called allodynia. So what that means is that you're petting him, a normal, something that's normally non-painful now feels painful to him.
Oh,
Okay? So just simply petting him back there, right here.
Yeah,
That's because
Okay.
he has what's called central sensitization. He's hypersensitive now to stimulus back there. You know, anything that touches him back there, he thinks it's painful when in reality it's not.
that's why Sam talked about gabapentin.
Exactly.
Okay,
She's so
she was
smart.
gonna try that.
Perfect.
Yeah, she's
Yes.
very good.
So we would put him on. I would put him on gabapentin. He'd go on Medicam and gabapentin. We'd probably stop the Medicam like 2 or 3 weeks after surgery, but the gabapentin I would definitely continue for like 3 months.
Okay.
And we'll have
And if you can talk with me about all the ways to
Yeah.
deliver it, because he
liquid. We get it
also-
formulated into a liquid, so it's easier. Yeah.
And I'll get it compounded with
Yeah,
some
we get it
flavoring,
compounded
'cause
over
he really
at
does not.
Palamed up the street.
He's really
Yeah,
not.
yeah.
Yeah, and they can ask whatever flavor you want, like tuna and chicken or beef, whatever flavor.
Would you put him on anything now in advance of doing any
Let's see,
surgery?
let's just wait for surgery.
Okay.
Yeah,
Okay.
let's see what happens with surgery. Yeah.
And-
But once
and-
we have surgery, that's what he's.
Because this should be corrected. This is not gonna, this
This
isn't,
is not gonna get better without surgery.
and it's gonna get worse
Worse.
as he gets older.
That's correct. Right. So it's either do this or put him, it's either do
Put him
this,
to
take your
sleep.
risks, or put him to sleep.
Okay.
That's my opinion. Like, I don't think he should live like
Be
this.
like
with-
this.
Correct, for the rest of his life. That's not fair.
And the fact that he doesn't go to the litter box, is that all learned because it's so
Yes.
associated with the pain?
Yes.
Okay.
That's-
Yes.
That was,
Yeah,
this
like,
is
cause
so
listening to you talk, I was like, I was
confirming for me.
convinced that his anal sphincter was not gonna work, but it's working. So he's just, and you know, and it may take him a little while after surgery too,
To
to start,
retrain
to
himself.
retrain his
Yeah.
brain, those nerves need to be retrained.
Yeah, but the
So-
gabapentin will help.
Hopefully,
and-
yeah.
Yeah. Well, at least we feel like we've
Yeah.
done everything we can.
At least you know now what's going on, and yeah, Sam was totally right, and
It pauses
Yeah.
that kind of group that
Yeah.
they do want to.
yeah, yeah, so